I'm Andy Gilliland. I am the Director of Sports Medicine and one of our sports medicine physicians. The sports medicine program here has gone through a ton of growth over the past 10 years. We've grown from one high school, one university to multiple universities, and practically every high school within the region has some form of an affiliation with us. We've been really lucky that when we've added someone on over the past 10 years, they've stuck around. And that continuity of care has really helped grow our program to where we can firmly say we are the leaders in the tri-state when it comes to this type of care. Being from the Appalachian Mountains, we know that there's certain struggles that we have here, and having people that understand that really helps our student athletes.
I'm Brock Johnson. I'm an orthopedic surgeon with King's Daughters. I see patients out of Portsmouth, Russell, and Ashland. I specialize in sports medicine, some joint replacement as well as general orthopedics. After my orthopedic residency, I did a one-year fellowship for subspecialty training in sports medicine. That includes, care of athletes, but also, anybody with problems in the knee, hip, and shoulder, with a special focus on a lot of arthroscopic procedures, soft tissue type of procedures around joints, things like that. And of my first exposure to the medical world was, through seeing my orthopedist, through various injuries that I had gotten playing sports, things like that. And coming up through my training, I knew that was always something that I wanted to be involved in. I'm involved with Shawnee State University as their team orthopedic surgeon. I work with some of the various high schools in the area as well, treating anything from lumps and bumps to some of the more serious injuries that may end up needing surgery. We're often on the sidelines right there at game time. We also hold training room clinics where the athletes can come and see their athletic trainers, but also their doctor. We have walk-in clinics as well as scheduled patients in the office to treat our athletes as well. Being able to get them through, get them fixed, get them through and through the recovery and back on the field is one of the most rewarding experiences.
We were ahead of the curve on understanding that if we reach out to these high schools and we provide all this other population-based health care, that we're going to affect change. And King's Daughters really embracing that premise, we're able to affect change on a level that's unparalleled. I think that as medicine changes, our program is going to remain a center point for young student athlete care. And one of the things that we've kind of focused on during our physicals, and I'd like to see grow, is that message of preventative health. Like, for example, our people that run the physicals, they now have information about mental health. They have information about tobacco cessation. They have information about STDs. So for the next 10 years of our program, I really want to see us focus on those types of things. It's a part of King's Daughters' primary message nowadays is, patient-centered home and those types of things and population-based care. How can we keep our people more healthy, right? And that's going to be our focus in the next 10 years. We're growing our therapy programs, and I envision, as a part of that preventative health care, going out to the high schools and working with that female soccer team about how to prevent ACL tears, working with the football team about neck strengthening regimens and how to prevent concussions. So that's where I think the next 10 years are, is kind of, we've got everything in place. Now it's how we shape this thing to what we want it to be.